Scott Loveridge with Michigan State University, and I'm your moderator for this session. Thank you for coming to join us on this. It's a very important topic. Thinking about the tie between health insurance and agricultural viability. We're going to find out a lot about the issue. There's been some really great work done on that, and also some tools for addressing some of the issues. But I thought we'd start by telling you a little bit about who's on today, or who registered to be on today. As you can see, the webinar has attracted registrants from a number of states around the country, and also in terms of what types of occupations they have. Mostly extension employees, but you've got a lot of people from the nonprofit sector, and then government people and researchers, agribusiness consultants, farmers and ranchers, and others. So there's quite a range of folks on the line today, so it should make for a very interesting conversation. So what are we going to do today? We're going to, first, you've experienced a little bit the chat. We'll also be doing a few polls where you will input your responses to some of the questions we have about this. The webinar is recorded, so you'll have the ability to get the recording later. I think Rosa usually posts the slides as well. We're going to talk about the research study, a national survey that was done. We're going to share with you some tools and resources to start conversations. There'll be a little bit of Q&A, and then thinking about what we can do down the road. So in terms of slides available to download as we follow along, you'd have to email Rosa or Shoshanah.
Yeah, gone off my name. There it is. Back again.
So
should I run the wizard?
I'm hearing you, Bonnie, so I think you're good.
Oh, great. Thank you, Rosa. Sorry.
So poll number one, why participate? So why are you here today? So if you could give us your answers on that real quickly. And we're just broadcasting those results as we go along. I can see that most people are here to learn about the tools or resources to help farm businesses navigate the healthcare market. But some other reasons to be here as well. So I think all of those reasons will be good ones to be with us today. So happy to do that. So that's good. The second poll is talking about the tie between healthcare insurance and agricultural viability. And are you as a participant confident, this is kind of a pre-test, and we'll ask you again the question at the end of the webinar, are you confident that you can help farmers and ranchers understand the tie between health insurance and agricultural viability? And I'll try to make the poll a little bit bigger. I got a comment here that people wanted the poll bigger, so we'll do that. Okay, very good. Well, next I want to introduce the project leader. That's Shoshanah Inwood. She's an assistant professor at The Ohio State University. She's leading a fairly large team. There was all the logos were on the slide earlier, and we have she's corralled all of us, done a good job of making sure that we're all organized, and so Shoshannah's going to be with us. We've got Alana Knutson with the Walsh Center for Rural Health at Newark, Bonnie Braun from the University of Maryland, Jake Jacobs at the University of Vermont, Maria Peppidas at the University of Delaware Extension, Adam Kantrovich at Clemson, and Bob Parsons also at the University of Vermont. So it's a great team, and Shoshana's been doing an excellent job of leading that team. And I'll turn it over to you, Shoshana.
Thank you, Scott, and thank you to everyone for joining us on the webinar today. I wanted to first give you some history on why we're researching this issue. So in 2007, 10 years ago, members of our research team conducted two unrelated but parallel studies. Alana Knudsen was a member of the Access Project that surveyed farmers in 7 Great Plains states about health insurance. And they found that 25% of farmers reported healthcare expenses contributed to their financial problems, and 20% reported debt from medical bills. I was involved in a separate national USDA-funded study examining farm persistence and growth. We asked commercial farmers to identify the threats to their farm. The number one issue they identified was the cost of health insurance. These studies led to the Health Insurance, Rural Economic Development, and Agriculture, also known as HIREnAg project, which was funded in 2014 through a USDA NIFA AFRI grant. Myself and Alana Knudsen are leading a team from 8 different organizations and institutions representing both research and extension. And our goal is really to understand how health insurance impacts economic development and the quality of life of our nation's farmers and ranchers. We are focusing on how health insurance impacts workforce vitality and risk management in the agricultural sector. So this project includes both a research and an extension component. We started the project by first holding national focus groups with extension professionals, tax accountants, and farm technical assistance providers to understand how they are approaching this topic, what are the issues they're identifying, and what types of tools would assist them with their programming. This webinar is a result of those focus groups, which Bonnie is going to discuss in more detail a little bit later. The information and tools we present today will be available on our website for anyone to use. And as we move through the webinar and go through the tools, we would appreciate you evaluating the tools. Constructive feedback will help us refine these tools and resources so that they can be useful in your work. Our project also includes a research component. We've been conducting interviews with farm and ranch families and have conducted a large household survey. The farmers and ranchers we are studying are in 10 case study states across the U.S. We're looking at 2 states per region that have been paired by their policy environment, so whether or not they expanded Medicaid. The data that we're sharing today was collected in 2016 and 2017. And looking at the demographics of our quantitative survey, you can see the farmers in this study are representative of the national farm population in regards to sales and also the number of beginning farmers. With an average age of 60, our sample is slightly older than the national average, which is 58. So the first tool we'd like to show you is the video Healthy Farmers, Prosperous Farms. We've taken the results of the study and turned them into a video that can be used to introduce the issue to a general audience. So please note while watching, the video needs to buffer around the 1-minute mark. It's not freezing, so just please be patient. As you watch the video, we'd like to ask you to reflect on what you hear or learn that surprised you, and please share your thoughts in the chat box. We'll take a moment to debrief after the video.
In 2007, Memorial Day weekend, with a house full of Girl Scouts, my husband fell off the tractor and broke his neck between C3 and C4. Bob needed emergency surgery because every time he moved his head or hands, he'd have electric shocks running up and down his arms.
Beth and Bob Kennett of Liberty Hill Farm are multi-generation dairy farmers in Rochester, Vermont.
Over the years, we've had several medical issues that have arisen, everything from our son David having a genetic kidney condition to my husband Bob falling off the tractor and breaking his neck. I'm very concerned about healthcare and insurance. It's really, really important for our family.
Farming is among the most dangerous occupations in the U.S. Injuries and illness result in lost work time that can have serious impacts on the business. Health is part of workforce development. Healthier farmers and ranchers are stronger, more innovative, and better able to cope with stress and adapt to disruptive events that come with farming. If farmers and ranchers can't access the health care they need, the future of the farm is in jeopardy. The goal of the nation's USDA-funded health insurance, rural economic development, and agriculture project, also known as HIREnAg, is to understand how health insurance affects both the economics and quality of life for our nation's farmers and ranchers. The farm business and farm family are often treated as separate entities, but the two are intertwined. 3 out of 4 farmers say health insurance is an important risk management strategy.
There's something going on the farm 24/7, 365. It never stops. There is no break. It never lets up. And that constant burden of responsibility is difficult physically, it's difficult mentally and emotionally. Health insurance has been a routine part of our budgeting plan for the farm to provide that health insurance for the entire family.
The U.S. farm population is aging and shrinking. With an average age of 58, farmers are vulnerable to higher insurance premiums. 2 out of 3 farmers report having a pre-existing health condition. Just over half of farmers are not confident they can pay the cost of a major illness without going into debt. And almost half are concerned they will have to sell their farm assets to address long-term health-related costs, such as nursing home care.
Farmers tend to be cash poor and land rich.
Through a public option. Young farmers report having more options removes the need to be locked into a full-time off-farm job with benefits, thus freeing up time, energy, and money that can be invested into growing their operation. Health insurance affects rural development efforts to build vibrant, prosperous rural communities. In this sample, 72% of farmers between the ages of 18 and 64 have an off-farm job for additional income and health insurance. Almost half of these farmers are insured through public sector jobs in the fields of health, education, or government, compared to 1/3 in the private sector and 20% in the nonprofit sector. Changes in employment and benefit options affect the financial stability and social well-being of farm families, with impacts reverberating through rural communities.
Give a farmer $1 and it multiplies like crazy, because we will spend it, and we will spend it locally. Yes, we're going to buy sawdust. Yes, we're going to go to the hardware store. Yes, we're going to go to the local gas station and the local fuel dealer, and we will spend it, and we will spend it in your community. However, what we contribute is not just milk. It is the stewardship of the land. It is the stewardship of our resources. It is providing open space, wildlife habitat, recreational opportunities. It's providing a part of the community. We provide mentoring opportunities for the high school kids in town. We're part of the 4-H system with the university. We're part of a lot of different community organizations. Is that contribution to community that our small farm has. That's the real impact.
Okay, so we had a few more moments of buffering in there than anticipated, so thank you for being patient. But we're really very interested in your feedback. So we'd just like to ask you in the next poll, Scott, if you could bring the next poll question, right? Thank you. Is this video a tool you would use or share with colleagues? So if you could just take a moment to just let us know yes or no. And after you've answered, if you would share some feedback in the chat box with us about the video, who could you imagine using this video with? If you want to comment on the length of the video. Again, any comments that you provide will help us refine the video as a tool you and others can use in your work. So it looks like majority of folks, about 84% are saying this is a tool that they would use, and about a little under 20% are saying that this is something that they wouldn't use. So thank you for sharing.
Yeah.
And any additional...
Just a word on the breakups that we had. I think because we have so many people on the webinar, it was taking a little longer to load than normally would be the case. And so if you were to use this in a program, you could download it and it would play much more quickly without the breakup. So if the 20% of you are saying that because of the choppiness, it's just the buffering of trying to get it through the internet that slowed it down a little bit.
Yeah, thank you very much, Scott, for contextualizing the issues we were having. Okay. So our project approach has really been to recognize that farmers wear two hats. And when they make health insurance decisions, they do so as individuals making decisions for themselves and their family, and as employers who need to make decisions for their employees. And today we're going to focus on the individual and family perspective. So health insurance is an important issue for all individuals and families. And we'd like to know, do you yourself have health insurance? So if you want to take a moment and share yes or no. So it looks like, as the votes are coming in, that the vast majority of individuals on this webinar do have health insurance, and there are some that don't. Okay, so the first question that we had is, how many farmers have health insurance? So our study found that 1 in 10 farmers do not have health insurance, and they often cite the high cost of premiums, deductibles, and the high cost of using plans as a reason for not having health insurance. And this finding is consistent with data from the USDA ARMS survey. USDA also found dairy farmers are the most likely to not have health insurance because they are the least likely to have an off-farm job through which they can access health insurance. However, we found that even without health insurance, farmers are highly conscientious of their health, and they're actively engaged in alternative and preventative methods to stay healthy, such as using food as medicine, chiropractic care, and bartering for health care. The vast majority of farmers and ranchers, 92%, reported that they and their families had health insurance in 2016. It's also important to note that 32% have 2 or more health insurance plans within the family. Farmers recognize that they have a dangerous job that's also very hard on their bodies, and 73% said that health insurance is an important risk management strategy. With an average age of 58, farmers are more vulnerable to higher insurance premiums due to age rating bands. And in this sample, 64% of all farmers and ranchers identified that they have a pre-existing health condition. Farm family health has direct impacts on the farm business enterprise, and 40% report that they or a family member have a health problem making it difficult to farm, which can directly affect the profitability and viability of the operation. We also asked questions about health insurance planning and found just under a quarter, 24% have a health savings account and 13% have a flexible savings account. In addition to health insurance, 78% have drug prescription coverage. However, less than half, only 44%, have dental insurance, and only 36% have vision insurance. We had many reports of farmers delaying visiting the ophthalmologist and optometrist. And with an aging farm population that operates large and heavy equipment, this can affect farm safety. In the video, we saw that health insurance needs change along the life course. Health insurance needs are different for young families with young children compared to individuals who are middle-aged and those who are actively aging. While, again, the vast majority of farmers and ranchers said that they had health insurance in 2016, access to health insurance can change along the life course. For example, in agriculture, it's common to hear of an operator or a spouse having an off-farm job for health insurance. However, death, divorce, or a job change can affect access to health insurance. So we wanted to share a case study of a multi-generation farm couple in their 50s who shared how health insurance affects both their production system and their quality of life. So the couple had historically had a very good health insurance plan through the husband's off-farm employer. And when he was diagnosed with stage 4 throat cancer, he was able to get the treatment he needed at an affordable cost. He went into remission, but during that time, the employer downsized and he lost his off-farm job. Prioritizing health insurance, the couple purchased a plan on the individual market. With their medical history, the couple knew they did not want a catastrophic plan. And while they thought that they chose a plan with ample coverage for their health concerns, they found a lot of surprises and out-of-pocket costs, tests and procedures that were not covered, leading the wife to share that even with an advanced degree, she's ashamed that she doesn't understand the plan. This led to a lot of financial and mental health stress in the family. The family also shared how they used to direct market produce at the farmer's market, but because of the throat cancer, the husband could no longer talk to customers, and the wife now has a displaced pelvis. So they're now exploring livestock production and marketing systems that shift away from intensive vegetable production and direct marketing. So take a moment and think, what would you do if you were advising this farmer? What would you recommend? We also heard from older farmers, particularly those who had been uninsured or underinsured, that they were finally able to see the doctor and obtain treatment for injuries and chronic health conditions when they were eligible for Medicare at age 65. Once we hit 65, everything was taken care of. And a very small number of farmers, particularly in areas that only had a small number of expensive health insurance plans in the marketplace, were finding alternative managed healthcare plans. However, these plans are limited in what they cover and do not cover vaccines. So older farmers, such as one in Michigan, shared, I have a Christian managed healthcare account. I need a shingles vaccine, but they don't cover it. I'll wait 2 years till I'm 65 and then Medicare will cover it. Younger farm families who had children on these plans also shared that they were taking advantage of county health department vaccine programs in order to ensure their children's health. An important research finding that was highlighted in the video was the link between health insurance, farm succession, and the transfer of farmland to the next generation. Just over half of farmers and ranchers, 52%, are not confident they could pay the cost of a major illness such as a heart attack, cancer, or loss of limb without going into debt. And close to half, 45%, are concerned that they will have to sell farm assets to address health-related costs such as long-term care, nursing home, or in-home health assistance. Farmers tend to be land-rich and cash-poor. These findings suggest that farmers will have to farm longer in order to afford long-term health care needs or sell land at its highest value, which may be for non-farm development, thereby making land more expensive for the next generation. So we're starting to understand and see how health insurance and healthcare costs contribute to the farmland access bottleneck and join other issues such as land costs, access to capital and credit, succession and retirement planning in affecting efforts to grow the next generation of farmers and ranchers. And we in the study are very interested in supporting and growing the next generation of farmers and ranchers. So we also specifically looked at young farmers ages 18 to 35 years old. In both the qualitative and the quantitative data, we found that young farmers strongly identified that access to health insurance impacts the future of their farm, and will determine their ability to stay in farming. Young farmers really like having health insurance. They identified the benefit of staying on their parents' health insurance plan till the age of 26 and described the feeling of facing a cliff when they were going to turn 27. Young farm families often have young children, and parents consistently emphasize the importance of having health insurance for their children, and they would prioritize health insurance either through an off-farm job with benefits, enrolling in a marketplace plan, or having their children insured through the Child Health Insurance Program CHIP, which is a means-tested program. Some shared how they would defer an off-farm job that could provide additional household income and capital for the farm enterprise, but would make them ineligible for CHIP. Young farmers are often early in the startup phases of their enterprise when profits may be low. And we were surprised to find that 2 out of 5, 41% of young farmers were enrolled in a public health insurance program, such as Medicaid, CHIP, or TRICARE. Farmers on public health insurance or marketplace plans share that having these health insurance options allow them to have more time, energy, and money to invest in their operation rather than be working full-time off the farm in a job for health insurance. Because farmers and ranchers who were working full-time off the farm share the challenges of being in a dual career. So another case study, a rancher in his late 30s shared that he had anticipated taking over his family's operation. However, when it became clear he would not inherit the enterprise, he purchased his own land. He would commute 40 minutes to his job at NRCS, which he kept for both the income and benefits, while coming home in the evenings to work on his ranch and still helping out on his family's ranch when they needed him. He shared the stress of commuting, ranching, and working full-time. I'm a believer that my family would have been a little better off if I was just working part-time. I wish that health insurance was offered for part-time, 30 hours a week work. You get more done, so you're not doing everything in the dark at 11 o'clock at night. And we heard this sentiment from other families who also described the stress associated with trying to excel in their off-farm job to ensure they wouldn't get fired and risk losing their family's benefits. We're also seeing how health insurance is tied to rural economic development. For the majority of farmers and ranchers over 65, they're able to access health insurance through Medicare. For those 18 to 64, they may have no health insurance. For those with health insurance, there's a variety of different options for accessing health insurance. The most common way that farm families is insured is through an employer-based plan, where 72% of our sample of 18 to 64-year-olds were insured through an employer-based plan. Among these farmers, about half, 46%, are insured through a public sector job in health, education, or government. Just over a third are employed in the private sector, and 20% are insured through the nonprofit sector. In rural areas, public sector jobs tend to be the most stable and offer the most generous benefits. And from this data, we see any changes in employment options and benefits will impact the social and economic well-being of the farm population and will have ripple impacts across rural communities. So this is a systems issue. And in the community and economic development field, we know a strong health sector is important for attracting and retaining businesses and employers. The continuing trend of rural hospital closures affects not only the jobs available within a community, but also the ability of these communities to attract and retain new employers. So we see health insurance is linked to farm family health and quality of life, risk management and farm economics, off-farm employment, retirement and long-term planning, land access for the next generation, and rural development. So finally, we'd like to ask you a question we asked in our survey. Should USDA represent farmer needs in national health insurance policy discussions? Okay, so folks are coming in. Great. You know, we've got 93 people on, so it takes a moment for all of the votes to be registered. Looks like about half the folks have inputted a yes or a no. And right now we're trending toward 96% saying yes and about 3.5% saying no. Okay. So that gives us an idea. It looks like about the majority of folks who are inputting are saying yes. So in our survey, 3/4 of farmers and ranchers, 74% said yes. USDA should represent farmer needs in national health insurance policy discussions. The upcoming Farm Bill has historically focused on creating economic development through agriculture by largely focusing on economic issues such as markets, capital, credit, access to land, and skill development, all of which are very important. Moving forward, it will be also important to include how household issues such as health, healthcare costs, and health insurance affect risk management, rural development initiatives, and efforts to grow the next generation of farmers and ranchers. Our work has found that the health sector and the agricultural sector have been siloed off from each other. And moving forward, having a coordinated approach between the health, agriculture, financial, and policy sector will strengthen our nation's food and agricultural system and contribute to a more resilient, vibrant, and prosperous farm population. Okay. Any questions?
So just input your questions into the chat box, and Shoshanah will answer them. Or you might want to look back at some of the ones that Bonnie hasn't answered. Like guest 6 said, just what would you expect the USDA to do if it got involved with health insurance?
Yep. Okay. So next I'd like to introduce Bonnie Braun, the University of Maryland, who's going to be talking about helping farmers and ranchers make informed and intentional decisions and going more in depth about some of the tools that you can use.
Thank you, Shoshanah. Everyone just keep on typing in your questions and or your comments. It's been very encouraging to see the chat going on and some responses and some, of course, we haven't had time to respond to, but Shoshanah, I'm going to look to you to be monitoring that as we move forward and answering any that you can. It is also our intent to put together a question and answer summary after this webinar. So we are truly wanting to engage in a dialogue as much as one ever can when you're at a distance. What I'm going to do right now is introduce you to some tools that you can use if you want to take this back and engage other professionals, legislators, whomever back in your community. Of course, the first one is the video, and Scott reminded you that when you see the video directly, it's not jumping and it doesn't have some of the problems that the buffering problem, getting enough of it to you fast enough over your capacity of your provider. So that's one, and we're going to take you through some additional ones now. We also, as Shoshanah mentioned, we really want some feedback on yes, but I wish you had a tool on, and you can fill that in your chat box as you go, or you can make comments or raise questions about any of the tools that we are sharing. The way we're going to do this now is that I'm not going to make some opening comments and share some findings from our research with you, and then we have a series of people that are going to address specific tools and talk about how they have used some tools out with farmers and ranchers. I want to make a point that reinforces something someone said about the video, thinking, well, I don't think I would probably share it with farmers and ranchers. They probably already know this. Well, for one thing, the video is intended to get the attention of those who don't. But let's never assume that everybody knows and understands all of what the content that was in this research that we condensed today to Shoshanah's oral presentation. So you may want to start thinking about a broad base of people that might use these tools. So with that in mind, let me see here, let me move on to the next slide. We actually conducted focus groups, as Shoshanah mentioned earlier, with 3 different kinds of groups: extension, text preparers, and technical assistants. And What they told us was that cooperative extension should be doing two key things: increasing professional development and the knowledge of applicable resources that are there to help bring together these fields, if you will, discipline areas and practice settings of the health area and the farm and ranching area. And the second thing was to span those boundaries that are there. And the Venn diagram that Shoshanah showed there is bringing them together, but we found they were disparate, and particularly after we did a summit in Vermont where people said, oh, we're either on parallel or terms, or we're not even aware of what each other are doing, and not particularly good communications. Now, you may be in a state where that's not true, but that's part of what we heard. So today's webinar is designed as the first of what will probably be several others to help build professional development among professionals so that you are knowledgeable and aware and know of some tools if you want to begin sharing this research and addressing the issues that arise out of it. And also the intent was to bring together people who were in both the agricultural helping professionals as well as helping professionals in the health sector. We also learned that they thought there were some strategies that ought to be used, and particularly three key strategies. One, to identify key farm and ranch decision makers. And these may not always be the people that you think of. Sometimes we tend to, through gender stereotype, who is the farmer. In fact, I've seen some comments here that sort of are implying that it's a male that is, and not always a female. I think we've got around a third of farmers are now identifying as female. So you want to probably balance both male and female. Another thing we see is the younger, the middle, and the older age groups, and who is making decisions within those operations. And then outside of those operations are who are making decisions that affect those farm and ranch decisions. So that's where you start to bring in people who are in the loan business, the tax advising, other advising, that sort of thing, as well as now, of course, this whole health professional area. I think someone said, well, what would USDA do to represent farmers and ranchers? Well, for one thing, it could be even a conversation between departments, other ways to bring folks together. A second strategy was to embed health insurance topics into broader programming. So some of you who do educational programming, whether in extension or not, there may be ways that you could integrate this and bring it to attention of people in your programming. When we interviewed people in these focus groups, they were saying to us, so we have farm winter meetings and we have gatherings of commodity groups, and there's ways that we could introduce some of this for people to become aware of the research. So it can be integrated into it. It doesn't have to stand alone. And then a third strategy they suggested was that information be disseminated through multiple channels. So one of our channels today, of course, is this webinar. Another channel would be a channel of the use of the video, and this next one that's coming up. Of course, there's the traditional printed materials, and we have some here available for you. Online, internet access to things, as well, of course, the sort of tried and true person-to-person conversation, sharing, and exchange. If you want to know more about what these professionals told us, we are very pleased to share with you today that there will be a forthcoming article in the Journal of Extension that shares those results. So now, Tool 2 is actually a printed document that condenses in the one page, front of a page, some key highlights of the findings that Shoshanah shared with you. And this could accompany the video or it could stand alone. And someone asked, where will these be available? Again, I'll come back at the end of this to remind you, but they are all available at the HIREnAg website. I was alluding to another video, and this is a video that we are about to show you. Yes, there'll be some buffer problems, so kind of hang in there and be patient. And there may be, we will have to have a little time between the end of it and when the next speaker comes up, so we'll pause for that. So let's go ahead and play Health Insurance and Farm Risk Management, produced at the University of Vermont. Scott, is this something you need to do something with? There we go.
Hello, I'm Bob Parsons, an extension agriculture economist at the University of Vermont. The issue of affordable health care has become a major, although seldom mentioned, additional risk for farmers and ranchers. Farm profits and access to land, capital, and credit have historically been the keys to a successful farm by farmers, lenders, and USDA. However, health care and the fear of what a health crisis can do to a farm family is not far beneath the surface for farmers and ranchers. According to a recent national study conducted by the University of Vermont and funded by the USDA, nearly 3/4 of farmers and ranchers say that having affordable health care insurance has become fear they could not handle the costs of major illness or injury without incurring debt that could threaten the viability of their farm. Health care costs are at the forefront of a farmer's mind. Farmers and ranchers are questioning how they can pay for health care costs with other family and farming or ranching business expenses. Mix in that farming is one of the most dangerous occupations and that farm operators often provide most of the labor. Health care costs become a matter of risk to be managed. There are different challenges among young farmers and older generation farmers, those with off-farm employment insurance and those with pre-existing conditions. But health care is a concern for all. The decision to have or not have health insurance impacts all farmers on the profitability and future of their farm business. In addition, fear of health care and long-term care costs are often mentioned as a major reason older farmers don't move forward on succession transition planning. Thus, the risk of illness and injury and cost of care is a constraint on farm operations. How will your farm or ranch business address the issue of health care costs? It's a risk management decision that requires communication among family members, assessing risk, and deciding what is best for you and your business operation. It's a decision to be revisited yearly, just as you may revisit crop insurance. Preparation is the key to healthy living and farm viability. To help make these decisions, Cooperative Extension has developed educational materials, such as a guide to understanding and estimating costs as part of the Extension Smart Choice, Smart Use health insurance program. Are you prepared?
So that video is a little less choppy than the first one. I think it's basically a function of the size of the file, but if you go to the website and download them, it should be fine to play in with audiences or send the link around. So don't worry about the choppiness in other formats. It's just trying to do it through a webinar is a little harder. Bonnie, do you want to take it from here and introduce Jake?
Yes, I was hoping to let that finish. I was still listening to it myself, so I was pausing here because we don't want to interrupt him. But let's see if our next...
Such as a guide to...
See, there it goes again. Is there a way you can just pull it off of there, or is it still all going to be in people's buffers?
It's slower on your system than it is on mine, apparently. It's been done for a little while.
Well, I'm going to try to go ahead. I hope that Jake is ready and she has...
Understanding and estimating costs.
Is not interfered with. As Scott just said, this will be available and you can see it straight through without interruption, and you'll be able to use it to show other people. We're really sorry. Some of you probably saw it directly and fast, and some of you were being delayed. And there we go. There we go. It's all gone now. Very good. So so we have two videos. We have a handout. Now to share with you is from Vermont is Jake Jacobs, who's going to address a questions to ask tool. Jake, you there and ready to take it away?
I am. Thanks so much, Bonnie. And I want to say hello to everybody, and thank you so much for tuning into this webinar. I work in the area of agricultural risk management, and I meet producers and growers with enterprises in all types of agricultural production. And while we are all aware that farmers and ranchers routinely face many risks in their businesses, one area that owners and managers frequently don't include is health care costs. When looking at business management and planning, farmers and ranchers have to consider everything that can impact the operation. The potential threat posed by healthcare costs is a possible hazard that needs to be included when assessing the entire risk picture. As business consultants and advisors, you're in a unique position to help farmers and ranchers make informed and intentional decisions about managing healthcare costs and reducing the risk these expenses can pose to farm and ranch viability. With this in mind, here are some questions you can ask to help zero in on how healthcare costs should be incorporated into the farm or ranch business plan. First, does your health and your family members' health have any effect on the way you run your farm or ranch business? If your health or the health of one of your family members were to change, perhaps through something like an injury or illness, would that have any impact on your business? In the event of some health incident, such as an accident or illness that would require emergency room care, hospitalization, rehab services, or long-term care, could you cover your health care costs without going into debt? Can the profits from your farm cover the costs of health care, including out-of-pocket expenses, insurance premiums, deductibles, and insurance copays? If the answer is no, do you see health care needs and the costs to cover health care as a potential threat to your farm or ranch viability? I believe, is the screen advancing for folks?
There we go.
Okay, do we have it now?
If you could use the arrows to get it on the slide.
And right now we're looking at the kind of field that we would all like to have in the back 40, where the baler kicks out money bales.
Yes.
So, looking ahead, there are bound to be some life changes and transitions, perhaps having a new baby, children going off to college, adult children turning 27, you or your spouse turning 65, or perhaps elder care for an aging parent. Have you planned for the ways these transitions might affect your health care costs and the overall finances on the farm or ranch? And finally, where do healthcare costs fit in? Are they covered as business expenses or paid as part of the family and household expenses? To help protect the farm or ranch operation, we suggest that you take time to talk with family members and business advisors. Find answers to these questions, just as you would not consider omitting expenses like production costs when working on farm and ranch business plans. The costs for health care must be included too. Professionals working with farmers and ranchers asked for a tool to help them bring awareness of the role of health care costs in farm and ranch viability. To help advisors and consultants and farm and ranch families, we prepared a fact sheet with questions that bring focus to discussions about health care costs as they relate to the agricultural enterprise. This fact sheet is located on the HIREnAg website. And I apologize that my slides did not advance, but the questions are outlined in that fact sheet, and hopefully that would be useful for getting the conversation started. If you have any questions, you certainly can type them in, and I'm going to pass this back to Bonnie.
Thank you, Jake. Yes, we're sorry that that occurred, but the key questions, as she said, are on this handout, and that will help you. So the thinking about this was that you could do this in a group, raise these questions. You could do it if you're individually meeting with someone, to raise some of the questions for people to be thinking about, like about how are you going to pay for it, and things that maybe have not been the questions that have been asked, or at least maybe known and understood across the community and among different professionals. So thank you for the work you put into that and for sharing that, Jake. We're now going to move on to Maria Peppidas, who's in Delaware. She's a part of a health insurance literacy initiative multi-state team, and she is going to be sharing with you some ideas about how to better understand and estimate health care costs. So welcome, Maria.
Thank you. I'm glad to be here. So I'm Maria, and as Bonnie said, I'm with the University of Delaware Cooperative Extension, and I've been working as a family economist over the last 25 years of my career with Cooperative Extension, working with families and farmers to manage their personal finance more effectively. Today, I'd like to share some health insurance tools that have been developed to help people better understand and make decisions about health insurance. Since 2011, a team of extension professionals from the University of Maryland and myself from the University of Delaware Cooperative Extension have been working to reduce confusion and increase confidence and competence when it comes to health insurance. Today I'm going to introduce you to a couple of resources offered by this health insurance literacy team that you can use with their clientele. What we have learned from our research is that many people are confused by health insurance terms. They make choices about healthcare plans, but they are unsure if it is the right choice. They are unprepared when it comes to covering the costs of care because most don't have the savings. And this leads to going into debt to cover costs, or worse, filing bankruptcy due to medical debt. We know that 20% of American adults are struggling to pay their medical bills, and that 60% of bankruptcies, personal bankruptcies, are due to medical bills. And we know that people put off getting care if they feel they don't have the money to support the cost. All of these factors and more lead to the development of a variety of educational programs and tools to use with consumers. Two of these tools I'd like to share with you today. The first tool is the My Smart Choice Health Insurance Workbook. It is designed for consumers who are trying to comparison shop across plans. This 26-page workbook provides background information necessary to understand how to select and comparison shop health insurance plans, whether clients are choosing from the health insurance marketplace, independently through a broker, or from an employer-based benefits menu. This workbook walks users through the process of making a smart choice about possible health insurance plans and helps them determine if the plan can fit into their monthly budget. This tool was designed to be used by consumers who are in the process of choosing a health care plan. The first step is to identify healthcare needs by inventorying their use of care. We ask people to think about how many times they go to the doctor or use healthcare services in the last year. Based on this information, they can determine the types of healthcare services they may need and the number of times they actually use and access care. If people have not accessed care in the past, we encourage them to inventory their needs by at least going for their annual checkups. Note that on each page of the workbook, there are new health insurance terms, and they're identified on the right-hand side. And so these are the important words to know, people need to know to really understand the material. The next step is to compare offerings and the costs across 3 plans that the user may be considering. And so what you'll notice here is there's a bunch of criterion on the left-hand side in blue and 3 columns where as someone is actually comparing plans, they can mark off information about those plans so they can see them side by side and be able to compare them. The next part of the workbook uses information calculated from the previous pages based on how users actually use healthcare services, the number of times and the co-payments charged by each of the plans, the deductible, and other healthcare costs are compared across the plans, and then the annual and monthly amounts are determined. The last step encourages users to develop a monthly spending plan, and then based on the monthly figures for each health insurance plan, determine which health insurance plan best fits into their budget, or to determine what other expense categories might have to be adjusted in order to have the health insurance plan that really meets their needs. This workbook is available for download and use, and I'll provide the URL at the end of this presentation. Tool 6 is understanding and estimating healthcare costs. While the previous tool was designed to help people who are in the process of making a health insurance plan choice, the next tool was designed for consumers and is designed for those who want to better understand the plan they already have chosen and determine how much they should be saving each month over and above the premiums to ensure that they have the money they need to access care and reduce the chances of going into debt. In a step-by-step method, this publication walks people through the process of identifying their fixed and flexible healthcare costs by using their health insurance documents and estimating how they use healthcare services. This document also provides important health insurance terms and definitions. There are several calculations in this fact sheet. The first helps people determine the minimum amount to save each month to assist in covering out-of-pocket costs that are over and above the amount paid towards the premium. This is an example, this visual is an example of the type of calculation someone might go through. Additional calculations include the maximum amount to save to ensure that the out-of-pocket maximum is available in savings, Another is the total out-of-pocket spent on healthcare, including premiums. Another is the amount you might save in a flexible spending account, the amount to save in a health savings account, and lastly, some help to determine if they can deduct medical expenses on their personal income tax form. I wanted to make you aware that we'll be conducting a consumer webinar on October 26th and November 1st from 1 to 2:30 p.m. Eastern Standard Time. The registration for these webinars are on the same URL I'll be providing, so please feel free to share the webinar information with your clientele. This is a just-in-time for open enrollment periods for Medicare supplement policies as well as the health insurance marketplace. I know what you're thinking. How can I access these tools and share them with my clientele? Well, they are all on the University of Maryland Extension Ensuring Your Health webpage. The link will be available on the HIREnAg site as well. Tools are in PDF format, so they're easy to save and share. There are other resources there too, so we hope that you visit and look through a variety of the fact sheets that we have. Please be aware that these materials are trademarked and copyright protected, but you can print and share with your clientele freely as long as you don't change them. Coming soon will be more resources designed for the farming community. And if you have questions or ideas about resources needed, please share them in the presentation with this presentation team. Thank you.
Thank you, Maria, and she truly means that. We want to hear from you. We've gone through the tools that we have available now. We're going to hear about using tools and a testament from working out there in the field, but we do want to hear from you if there's something you wished we had offered here today, or you have particular questions about these. And I thank you, Kara, for mentioning that they're useful. Hard to find numbers. You're certainly right. That is one of the greatest challenges with a health system now, is finding out what things cost. And so it's not the same as shopping for some other things. But there are still ways of learning more and being better prepared than what most consumers are, according to the research that's been done out there. So let's move on now to hear from Adam, who's down in Clemson. And Adam was on those focus groups and talked about how he had been trying to educate people in his state. And we've asked him to share some of that testament now. So Adam, welcome, and take it away.
Thank you, and good afternoon, everyone. Prior to arriving at Clemson, I was at Michigan State University Extension working in the field and worked with a number of farms. And about 7-8 years ago, the healthcare really became a relatively large issue, and things had kind of changed a little bit on the farm. We had a number of farm situations that began to take place economically with regards to markets, and so we began to see a significant interest in dealing with personal health care, and that created a number of challenges. And so I'm just going to take a few minutes and talk a little bit about kind of what I saw in the field. And for those that do not know, I work with a great variety of farms from sizes, and given in this particular situation, I may have worked with farms that the only labor they had on the farm was that of the family, to farms that employed and provided over 1,000 W-2s. And so a great variety of farms. And as it related to this healthcare dilemma, as Shoshanah talked about earlier, there's really two different pieces of this. One is, the employer-employee piece, which I'm not going to really discuss today. I'm going to focus on the farm owner, operator, and family. And so from the employer-employee piece, however, their issues really dealt with understanding health insurance and associated laws and regulation, the compliance of that, and farmers having to begin to think of, due to labor challenges, a human resource component that they had not really had to deal with in the past. When it related to the farmer, owner, and operator family, they just needed to understand what the associated compliance laws are for them. And in many cases in the past, they really didn't have to think about or consider some of the things dealing with health insurance, and now they had to deal with and start looking on their own to health insurance and began to become confused with what everything meant. Definitions, how does it work, what are deductions, what does this mean, the maximum out-of-pocket expenses, all of this type of stuff. And then how, they had an idea of how it played a role with regards to risk management, but not necessarily how it truly was integrated with everything that they do onto the farm. And so a pretty typical case, I was working with, for me anyhow, I was working with a farm family on usually other issues. And health insurance was always a secondary issue, but it was a very important issue that had to be dealt with. And as I was working with the farm, whether it was taking a look at farm succession, whether it was looking at possible expansions, contractions, retirements, or just they were having issues and needed to look at doing a few different things financially. And so this discussion determined, the needs and the fit into the short-term and long-term plans and how to consider health care and health care insurance and what their needs were. And in many cases, due to another counterpart of mine, I had already seen and started using the Smart Choice decision tools and tools that are available that you were just shown. I've been using that now for quite a while. It is a phenomenal tool, and so I literally had a box of these that I kept in my vehicle, and that was one of the things that was part of the material that I took out when I went to a farm, because invariably I would get questions as it related to health insurance while I was there. And as I was doing larger group talks, whether it was dealing with healthcare compliance, whether it was dealing with human resource management and labor issues, or markets, I usually brought a group of these, sat them down on the table, and I never had to take any home. They were pretty well utilized, and I received a number of positive feedbacks from a number of the farms that I had worked with. And like I said earlier, this is part of the larger risk management plan, and we also have to understand that each farm and family is unique with a different need and requirements as well as different capabilities. So what I want to just tell you about is just one of the examples that I had of working with a farm, and this is a particular dairy that had 130 milk cows, about 125 acres. So it was a relatively small dairy. Mom and Dad were in their early 60s with 2 children, and they wanted to be able to keep the farm in the family. Dad worked the farm full-time, but also had stage 4 incurable disease. Mom worked off the farm to maintain benefits and herself and kids. Dad was not covered due to the cost, and that was prior to 2010. And one of the things that began to take place following 2010 was that he was able for the first time to be able to receive and get health insurance. And given they wanted to be able to keep the farm in the family due to the stage 4 disease that he had, they were not planning any sort of succession. Due to the size of the farm, they were not going to be able to get this into the next generation because they had plans of utilizing the land that they had owned and selling portions of that as needed to be able to provide health care for Dad. Once 2010 came around, health insurance became more affordable. The existing prior condition was a non-issue. Dad was able to receive affordable health care given the situation, and they shortly following that, in about 2012, began the process for succession into the son. Now, some of my final thoughts as it relates to working with farm families, especially if any of you deal with farm management and are on the farm, is one, as you walk in and you're working with a farm family, is first, listen, allow discussion to happen and develop, and then need to figure out how to learn or to know what are the right questions to ask of that family, because sometimes I found when being out there was you get out there for one particular purpose, and as you begin to guide the family through discussion, you really find out the core issues at hand, and that really allows you to do a better job of assisting those farms. You need to know the resources that are available to assist that farm family, and then help develop a plan of action and provide the resources, such as some of the ones that you've already seen today, and guide that farm and family through that process. Let them make the necessary decisions, especially as it relates to their health care needs. You can help provide them the resources, you can have the discussions, but you cannot be the one to actually make the decisions, because they're the ones that have to live with those decisions. And with that, I'll kind of watch for questions, and we'll hand it over.
Oh, thank you so much there, Adam. That sounds like a good experience base and some great testament to the work you've been doing and some of the tools you've been using, and a wonderful reminder that we're never about making their decision. We're there to help guide them and to inform them and to perhaps bring something to their attention that they didn't know or weren't aware of, or at least to get a framework that they could use to do that. So thank you for that. Several of you have been asking about these tools. I don't think they're all up yet on our HIREnAg AgNet website, but they will be. There's a picture here of our website, and that big red circle up there is circling what's called tools and resources. So that's where you will find the things that we have today and other things as they come online in the future. And then in addition, all of the Smart Choice, Smart Use materials are available on the University of Maryland's website that Maria mentioned, along with many other resources that she didn't address today. So this is what we've gotten done for you so far, and Adam would welcome any of your comments or questions about his presentation, but we also would welcome any comments or questions just about tools in general. The goal here, based on the research we had done, was to provide you with things that you could go out and experiment with and see if they began to help, and perhaps you'll have some testimonial stories just like Adam. So with that now, we're going to move to some of the next activities, and I will be quiet.
Bonnie, were you going to talk about the upcoming award?
I am, and I'm sorry, when I saw that other slide, I thought, okay, somebody's going to do something, not me, because I know what that was. So, okay, yes, let's see, it's disappeared now. Sorry about that. But yes, I wanted to share with you that we have just been awarded a grant by the Northeast Region Center for Rural Development to do some additional webinars. These webinars are to help you all out in your communities develop a coordinated community risk management approach to health and health insurance among farm enterprises. I think earlier I saw a note from Graham who said something about advocacy, and my response was there is a need for conversation around additional advocacy or education or advising of people. And we know what had happened in Vermont. There was a successful summit there, and as a result, some activities are taking place. What we will be doing here is help you think through how could you introduce this topic into your community. So there will be more about that sent to you later, as well as there will be the follow-up from today's webinar, giving you information, reminding you where to get your tools, and that sort of thing. So we are certainly very grateful to the Northeast Region Center for making that award to us, and you will be hearing more about that in the near future. So it's time for poll number 6. Remember, we had that pre-test a while ago, so we want to come back and have you assess, now that you've heard what you've heard, seen what you've seen, how confident are you that you could help farmers and ranchers understand this tie that we've been talking about between health insurance and agricultural viability? Give you plenty of time here to respond. Quite a number of people to be doing that. Let's see, we're only heard from about a third of all of you. We really would like to hear from some more of you, so please do complete this. Oh, good. Our numbers are increasing. I'm still going to let you have just a wee bit more time. This is an important poll to us as we try to figure out how to improve in the future and what we might do to help your confidence go up. And I don't see any more input coming in. I believe we can end that poll, Scott, and move on to the next. Now, for this next question, we would like to use the chat box and type in there one action that you intend to take today as a result of today's webinar. And of course, you may not decide to take anything. So you say, I'm not making that decision yet. But if you have an action in your head, like I've noticed somebody here saying, oh, I'd like to use Smart Choice in Arizona, Ohio, you could take that action of contacting me. There's my email address, and we could help you learn more about our materials and how you could get trained if you wanted to and how to use them, that sort of thing. Here's somebody said they're going to download the workbook and rewatch it. I will tell you that our professionals have found that workbook as useful for them personally as they have for people that they serve through their programming. And that also includes, by the way, healthcare workers, navigators, and that sort of thing. Because when it comes to knowing and understanding health insurance and then using it to your benefit after you've got it, most people are not at all confident that they know how to do that. They don't really understand terms, and that's what our programming is designed to do, to help change that. Okay, I see somebody's going to check out the cost web sheet, the work site, going to make the materials available to resources during a farm management school. Great, Amanda. Anticipate including it in planning for healthcare and healthcare costs in the beginning farmer class. Clearly there's a tie to the beginning farmers based on the research and their concern and interest in this. So that sounds like a good thing to be doing. More of you are typing. We're not going to go on here. We have time. So we do want to hear from you about what you're thinking about doing. Another one thinking about implementing Smart Choice and Smart Use down in North Carolina. Another farm management school. Oh, here's someone mentioning Annie's program and the Women in Finance section. Some of you don't know about that. Annie's project is targeted towards women in agriculture. There's a health coalition committee going to be meeting this Thursday in Vermont, so this is timely. This can be shared around their strategies that they have been using following their efforts last fall when they had a big summit. Oh, adding to an enterprise grant for your beginning farmer class. All right, up there in Alaska, way to go. Hope to hear that that works out well for you. I see some folks are still typing. That's great. It sounds like not only did your confidence level go up as measured by that poll, but you're also telling us now that you see that you could take at least one action and as a result of this, and that's very encouraging. Any educator always wants to hear that it's meaning something and it's going to be something people can use. Tools you can use was the theme of those that we introduced, and that's exactly what we hope will happen, is that you and others will be able to use these as you learn more about them. I think we will go ahead and put up our next poll. You can feel free to keep saying what you might do with this, but we want to know something about when you might do it. And so not only are you saying you're going to, but when might you do this? Is this something you might do immediately, by mid-November, in other words, another month from now, 2 more months in December, skipping ahead to spring, or you don't plan to take any action, or you're not going to vote on this? So give us some sense. This is not only important to us, it's also important to you, because it doesn't really happen unless you kind of nail in your head, this is what I'm going to do, and this is when I'm going to do it. So yes, think about that a little bit. I'm going to watch those poll numbers. We're nowhere near how many of you there are available to vote. I'm going to be quiet for just a little bit, let you keep on typing and thinking and responding. Okay, one last call for the poll. If you haven't responded to the poll, please do so, because we will be closing this shortly. All right, no change on this. We can close this out, Scott. Here you see acknowledgments to our multifaceted, many-state engaged team with the professionals behind not only today's webinar, which includes our own Caitlin Morris, Bob Parsons, and Beth Holtzman, but also the folks that have been serving on the research team that has been carrying all of this out. And of course, we have to thank the USDA for granting us the money that enabled us to do this very cutting-edge research. You will be able to see a number of articles that are coming forth from our group in the near future. We will also be making presentations at a variety of professional meetings, as well as commodity meetings, Women in Agriculture next spring, to advance all of this work. And we are so appreciative that you were here today. You will also be hearing from us not only with kind of a report from today and some follow-up, but you'll also be receiving a survey, a very quick, short survey to let us know about, well, when you went out there and did your action, what happened, and how might we be of assistance to you as we move forward in our planning for more the webinars and other educational tools. And quite frankly, the team under Shoshanah's leadership is thinking about advancing the research and continuing the research and looking for funding to be able to do that. So we're also interested, of course, in your interest in additional research. Earlier today, I saw on some of your comments up here some questions that you would like to have answered. I think we got to a number of them. Some of them, because this is a summary of the research, was not shared. And then in some cases, I noticed a question or two that we haven't yet considered. Everything that you have put in here in the chat box, our team will be going through and looking at, so it can inform not only how we did on the webinar, but also inform our research and our outreach going forward. So we thank you for all of those comments. I think with that, we're ready, Scott, for you to take it over and go from there.
Yeah, I just want to thank the whole team for an excellent overview. There's a lot of detail behind the work that was shared today. So this is kind of the beginning. The people on the line have learned about where they can access these resources and dive in deeper. So that's really was the goal here today, and I think we accomplished that. Please do download those videos and look at them in a better play format. I think you'll find that they're quite professional in that format. And as Bonnie mentioned, we'll be looking at the questions that came in on the chat, and we'll try to get those summarized and posted onto the website as well, so that others that may be tuning in different ways can see some of those answers as well. So I appreciate everyone's time today. What a great audience and great presenters.